I'm Dr. Rajdeep More, consultant gastroenterologist. Today we will be talking about hepatitis and the various causes of hepatitis. So hepatitis basically means the inflammation of the liver. The liver can get inflamed because of an injury or any infection. So the commonest causes of hepatitis in our country is primarily viral hepatitis, that is viruses such as hepatitis A, B, C, less commonly D and more commonly E. Also, chronic alcohol consumption is something that can damage the liver and cause what we call as alcoholic hepatitis. There are some medicines and chemicals which can inadvertently damage the liver and cause hepatitis. And another specific type of hepatitis is what we call as autoimmune hepatitis, where the antibodies are generated against the liver and they cause damage to the liver, leading to autoimmune hepatitis. Now, what are the signs and symptoms of hepatitis? The patient usually presents with what we call as abdominal pain, fever, vomitings, nausea, generalized weakness, and sometimes yellowish discoloration of eyes and urine, which is known as jaundice. So let us discuss now what are the types of various hepatitis which can cause these symptoms, as well as what are the different types of management that we can do. So regarding the viral hepatitis, so hepatitis A and E are predominantly waterborne and foodborne diseases where the transmission can be because of consumption of contaminated foods, contaminated water. In such patients usually develop a severe generalized weakness, severe muscle pain, severe vomitings, nausea, and the liver enzymes may go to very high levels. In such cases with hepatitis A and E, usually the illness is self-limiting and patient requires admission and supportive measures in the form of IV fluids, IV painkillers and IV analgesics like paracetamol for fever relief. Moving on to the more chronic hepatitis such as hepatitis B and hepatitis C. Now hepatitis B and hepatitis C not just cause chronic hepatitis, that is some permanent damage to the liver, but they also have a chance of converting it into hepatocellular carcinoma or liver cancer. So hepatitis B and hepatitis C are primarily transmitted via blood transfusions or by needle prick or through sexual transmission. Once the transmission takes, the virus can stay in the liver dormant or inactive or in the carrier phase for a longer time and do not cause any problems. Or in the severe cases, it may cause severe liver damage, hepatitis, and eventually can lead to what we call as liver cirrhosis. Now let us discuss about some of the diagnostic modalities to diagnose hepatitis, as well as how do we go about treating it. So in diagnosis, history and physical examination is very important, where we know a history of whether the patient has had outside food consumption for hepatitis A and E, history of needle pricks or blood transfusion or unsterile syringe use in hepatitis B or C, and also history of whether the patient has had chronic history of alcohol use for alcoholic hepatitis. There are fewer other tests that need to be done, such as the routine complete blood count and liver function test. The aminotransferase levels in the liver function test may be elevated, which suggests that the patient has had hepatitis. The imaging modalities are very important. The commonest one in outpatient that we have is the ultrasound of the abdomen. That tells us whether there is any inflammation on the liver or if there is any chronic damage or permanent damage that has happened on the liver. Newer tests are available, non-invasive tests such as fibroscan and an MR elastography, which will further help us to know how much is the damage to the liver. In spite of extensive investigation, if you do not find a reason, we may have to go for what we call as a liver biopsy. Now, how do we go about treating hepatitis? So hepatitis A and E is self-limiting, so only supportive treatment is enough. For hepatitis B and C, there are specific antiviral drugs that have to be taken. So always consult your doctor for any specific antiviral drugs that need to be given for hepatitis B and C treatment. Also, it is important to take vaccines in case if vaccines for hepatitis A and hepatitis B in case if you are living in vicinity of people who have such hepatitis. Obviously, alcoholic hepatitis, it is very important to concentrate and focus on quitting alcohol and having a healthy and balanced diet. Moving on to some general tips that one should follow to have a healthy liver. Regular exercise, at least 5 days out of 7 days, 30 to 45 minutes of brisk walk every day is good enough to maintain a good, is the bare minimum that needs to be done in terms of exercise. It is important to have a balanced diet. In patients with liver disease, we usually recommend a high protein, high calorie diet, which will supplement your dietary needs. It is important to not consume any unsupervised medicines, or without the supervision of a doctor you cannot have medicines for a very long time, so that should be avoided. And lastly, it is important to focus on, so it is important to routinely follow up with your doctors and get yourself checked for any liver diseases or any abnormalities in your liver function test to lead a happy and healthy life. Thank you.